Romo lalruok kod puonjo rawere wi kido kod dak maber obagi Mombasa ma okelo kanyakla rawere kod jokanyo mag sectors kaka mag dini kod mamoko. Ka giloso Mombasa romono, jokanyo go wacho ni kido kod timbe ma kindegi osekalo kod dhiero oserwako nyithindo manyiri timbe marocho ratechgi. Bende oyangore ni midhiero ma kamago medo kelo landruok mag kute mag ayaki e kind rawere.
We struggle with the issue of consent, we struggle with the consent, and we think about that girl living for the family. And when it is not able to go out and places in our continent, who do we expect? What are the causes of them being pregnant at 12, 13 years? Is the information available for them? Is this information all available? We talk about age-appropriate information. Is it available for them?
The government is committed and is keen in ensuring that in the rollout of universal health coverage, the benefit package for adolescents and young persons is comprehensive.
Some of the issues that we've been facing as adolescents and youth, we have the triple threat. That is teenage pregnancies, new HIV infection, and sexual gender-based violence. And the latest report that the NCDC came up with, it showed that we as young people, we are the ones that are having the highest number of new HIV infections.
If the education sector did what they have to do, if the religious organizations did what they have to do, the Ministry of Health and even families, young people would have